Retatrutide is taking over the peptide conversation. It's a once-weekly peptide-based drug that is still being tested and is not FDA approved yet. The weight loss numbers are extraordinary. That sounds exactly like the kind of drug that would make diet and exercise obsolete. But here's the part that almost everyone misses. The better the drug gets at moving the scale, the less the scale tells you about whether you're actually becoming healthier. So on this video, I'm going to show you three things. First, how powerful retatrutide actually is, and what the trials actually tested for. Second, what the scales can hide when somebody loses a huge amount of weight. And third, what diet and exercise are actually for when medication is doing so much of the heavy lifting. Yes, pun is indeed intended in that one. And stay with me to the end because I'll show you how to get the Retatrutide Research Database I'm using throughout this video, complete with the studies, charts, comparisons, and original sources all in one place. I'm Dr. Sajad Zalzala. People call me Dr. Z. I'm a physician focused on longevity and health optimization. If you like evidence-based longevity without the hype, please subscribe. Before we jump into the research for retatrutide, let's talk a little bit about the molecule itself. This is getting a little science heavy, so put your thinking caps on. So we currently have three major GLP-1 molecules on the market: semaglutide or semaglutide, tirzepatide, and retatrutide. The difference between these is that semaglutide is only a GLP-1, meaning it only acts on one receptor, as you can see here by this illustration. Tirzepatide works on two receptors, the GLP-1 and the GIP. Retatrutide works on three receptors, GLP-1, GIP, and another one called GCR. GCR is a glucagon receptor. This is where we think some of the magic of retatrutide happens. Now, if you want to learn more about the chemical structure, I've laid it all for you here. You can nerd out if you'd like. Part 1, what retatrutide actually did in clinical trials. Using my Retatrutide Research Database, we're going to walk through some of the trials and I'll point out the key data. The most important trial, also known as a headline trial, was the TRIUMPH-1. This is a phase 3 large randomized controlled trial and showed a very impressive average weight loss. But it also gives clues as to why the study design matters. So we're going to walk through the data here. Here's where the results get crazy. The average weight loss was almost 30% of body weight. Imagine if you're a 300-pound person, you lose 100 pounds, you're left at 200. That's crazy. Compare that to placebo. Placebo only lost 2.2%. Which is very typical of placebo. Anybody who's been on a diet or exercise plan knows it's very hard to lose weight just with diet and exercise. Not impossible, but most people find it very difficult to do. What's more striking is that almost half of the participants on the retatrutide lost 30% or more of their body weight. So here's how it breaks down. They tested 4 doses. This is all once weekly. They tested 4 milligrams, 9 milligrams, and 12 milligrams. And of course, the higher the dose, the more the weight loss. But even the lowest dose, impressive 19%. And we'll compare this to other GLP-1 medications. On to point number 2, what the scale can hide. Usually in clinical trials, we measure weight and we measure BMI or body mass index. These are useful numbers, but they're incomplete when it comes to health outcomes. We'll talk a little bit about why in a minute here. I'm proposing that there are 3 better health span scoreboards. Of the weight that you lost, what did you actually lose? Was it fat? Was it bone? Was it muscle? Also is function. What can you do now that you couldn't do before? Strength, fitness, mobility. And then how are you living and aging? What's your nutrition like? What's your sleep like? What's recovery like? We're going to talk a little bit about these. First, let's start with the body composition aspect. Now here we're going to look at the published data on fat loss versus lean. So here are the 3 molecules head to head. Now they weren't tested together in the same data set. And so there are some caveats. There are differences in the way that the studies were done and things like that. But this is the best comparison data that I could find. And so you can see with semaglutide, you get pretty good weight loss, 19.3% fat loss, but you also get almost a 2-for-1 fat loss to lean loss also. Now tirzepatide, you get a 33, almost a 34% reduction in fat and about a 10% reduction. This is 3-for-1, it's a little bit better. Retatrutide shows about a 26% loss of fat mass, 12.5. So actually I would say it's not a clear winner here, but there are caveats. You notice that they're using the 8 milligram dose and the timing is different. The tirzepatide trial is twice as long as the retatrutide trial. The tirzepatide trial and the semaglutide trial are about the same. So you can compare those, relatively speaking, head to head, but it's hard to compare. Retatrutide has just not been around long enough. They haven't been studying enough to get longer term data. I suspect that if you were to follow these patients out for another 36 weeks, and you would probably see a different story here. But this is the data that we have available. Here we dig specifically into the Retatrutide body composition study. This study was published in 2025 in the Lancet Diabetes and Endocrinology. I'll have a link for you here in this guide. So first let's start with placebo. Again, not very much to speak here. Very little weight loss, maybe about 5 pounds total, 2.4 kilograms for those 2.3 kilograms for those people who use the metric system. Then we have the 4 milligram, the 12 milligram, and the 8 milligram retatrutide. You can see the 8 and the 12 were very close. Both groups lost about 17 kilograms, 17 and a half kilograms, about 35 pounds, pretty impressive. But you can see that the yellow is fat mass and the blue is lean mass. So you can see in this case, it's almost a 2-for-1, maybe a little bit even worse. So this is not a panacea when it comes to weight loss. And remember that these participants were all on the same diet and exercise program that the placebo group was on. The placebo group, by its very nature, means that they thought they were getting the injections, but they weren't. Now, I just told you that in the retatrutide trial, everybody was on diet and exercise. They had a very regimented diet and exercise program. That's kind of the gold standard. There is a study on GLP-1s where they looked at GLP-1s without exercise, and that's the bone outcome study that I covered in my last video. Now here it is again, a little bit better visualized than last time. So this was a randomized controlled trial, 4 arms: placebo, exercise only, liraglutide only, and then a combination of exercise and liraglutide. So in this case, they looked at bone density, and you can see the placebo had like negligible change, 0.012, which it's probably about what you would expect for the timeline. I mean, you lose a little bit of bone every year, and that's why it's very important to maintain your bone, because you're going to lose a little bit every year. It's just kind of part of the natural aging process, unless you take action. That's a different story. Exercise, you saw with exercise, it was non-significant change. I mean, the numbers look a little bit different, but the p-value was non-significant. With exercise and liraglutide, you actually see very similar changes to what you do with exercise alone. However, if you look at liraglutide without exercise, you'll see a fairly significant change in bone loss. This bar here is the hip, and this bar here is the lumbar spine. So if you were to extrapolate this retatrutide or any weight loss, diet and exercise is more important than ever. What does this practically mean? It means you can have 2 people on the same exact drug. One's doing proper lifestyle changes, diet, exercise, sleep, things like that, and the other one is not. And you can have people who lose the same exact weight, yet under the hood, so to speak, they're completely different people from a health profile. So this highlights the point that I was trying to make earlier, that lifestyle is even more important when you have such potent medications. It's what your body can do and what it's composed of that's very important, and how it can function. As a bonus to today's video, I'm going to talk about the hype versus the evidence. We're going to hit on some points that you might have heard about with other influencers out there talking about Reta as if it's some magic molecule. It's very potent. There's no question about that, but there's nothing magic about it. So you may have heard that Reta melts LDL away. It's partially true. The study shows that it reduces triglycerides by 41%, non-HDL by 24%, A1C knocks almost 2% points off, and there's this very interesting study that it reduces liver fat by 82.4% and also drops blood pressure. Now, anytime you lose weight, you drop blood pressure. What we don't have yet, however, is cardiovascular and kidney. It's being studied. Those trials are probably going to come out in the next couple of years, so keep your ears out. However, what I was talking about earlier is not some new magic. So you might hear Reta melts fat without costing muscle. False. We've seen that here. You look at the studies, you get almost as much lean loss with Reta as you do with the other drugs. The difference is here, you have to exercise. There are plenty of, there have been other studies on semaglutide and tirzepatide where if you are on the right exercise program, you don't have to lose nearly as much muscle. People are talking about how this glucagon effect is somehow magic and keeps metabolism high. So far, there's no evidence for that in the clinical trials, but it hasn't been studied thoroughly yet. That would require specialized testing with RMR, resting metabolic, oxygen tanks and things like that. They just haven't done the studies yet. So it's possible, but I wouldn't take it to the bank right now. The next hype is it clears liver and visceral fat. Again, partially supported. And then number 5, it's really good for your heart. Well, we know it drops LDL cholesterol, so it must have some protective signals. And I suspect we will see those protective signals, but the data is not there yet. So, does retatrutide make diet and exercise obsolete? The answer is a resounding no. It may make lifestyle a little bit less necessary if your only goal is to lose weight and move the scale. But paradoxically, the better the medication gets at moving that weight number, the more important it becomes for you to look underneath it and make the right changes. And then ask questions, what is it that you actually lost? What can your body do better now? And which of the foundations of health are getting stronger while your weight is coming off? I would call this the new job description for lifestyle. Yes, lifestyle is still important for moving the scale, but it becomes even more important when you're using medications like retatrutide to move the scale as well. The injection may move the scale, but it cannot choose your food, perform your exercises or your squats, build your fitness, restore your sleep, build the habits that will make you live long and healthy. Now, before we end the video, there's one very important caveat that I have to make here. Retatrutide is not yet FDA approved. The drug company is supposed to be submitting for approval at the end of 2026 or early 2027. The earliest that will actually have a formal retatrutide product available is the middle of 2027. Currently, the products sold as Reta are not FDA approved, and it's very much a buyer beware situation. I hope you found the research database useful. Now, we only touched on some parts of it. There's a lot more there you can dig into if you're really interested in the topic. I made this database completely downloadable, available inside the optional aging community on School. Use the link in the comments to join my free School community where you can get access to this database. If you found this useful, please subscribe, and I look forward to helping you make aging optional.